Hello and welcome to the Health Research Podcast. This episode is a special edition from the HRB National Conference 2025, where we're recording from a mobile studio at the Dublin Royal Convention Centre. I'm your host, Danielle Barron. In this episode, we'll be hearing expert insights from some of the speakers at conference. We'll also hear voices from the floor and capture a bit of the atmosphere. But first, let's hear some of Minister for Health Jennifer Carroll-MacNeill's address to conference.
I'm delighted in particular to be here with Grania and Tracy, changing of the guard at the Health Research Board, and I'm so delighted to be part of that and to welcome you into this next body of work that you now begin, particularly yourself Grania, and we wish you so well with that. And of course it's the 40th birthday next year of the HRB, which is absolutely fantastic. Ireland and the Irish Government, just in case it needs to be stated, is absolutely committed to scientific research, committed on policy development based on scientific research, committed to science in itself. I can't believe that an Irish politician ever has to say that, but there you go, let there be no doubt. Entirely committed to the scientific endeavour and to supporting research and to building our society based on the outcomes of that research. But more than that, quite apart from the value of that in itself and the value of research as its own intrinsic endeavour, as having its own intrinsic value, which of course it does. From my perspective as a public representative and an academic, what I see the real value of research is the impact it's going to have on the people who live here. And that connection must always be there. It's so easy for me as a public representative being confronted with that all day, every day. It's very real as well for frontline clinicians. It can be sometimes more removed when your job is to separate yourself a little and look at a broader clinical or a broader research perspective. It can be harder to see that. But the huge altruism in that work is the fact that you are doing all of that research, all of that endeavour, all of that thought, all of that reflection for the benefit of people that you will never meet. We'll never meet probably the beneficiaries of the people who benefit from the work that you do. You may never meet the people 10 and 15 and 20 years from now who have slightly better lives or slightly better outcomes because of the thought and the endeavour that you put in. You may never meet them. And I think it's a wonderful act of public service to commit yourself in that way to people whom you will never know. It is just the very essence of public service. And I think that is probably my absolutely favourite thing about research and the value that it brings to our society and continues to bring to our society. So the work that you're doing, the work that the HRB will do in its next programme is of exceptional public importance. It's of exceptional public importance to the health of our society, to the health of all of our people, irrespective of wealth status, irrespective of means, irrespective of education, irrespective of anything. The work that you're doing will extend lifespans. The work that you're doing will extend the quality of life. We know that we have this extraordinary challenge in respect of ageing and how we're going to age, how every person in this room is going to age, the different challenges that we're going to have and how we're going to need to use medicine, how we're going to need to use resources and change practices to be able to meet the needs of all of us and all of the people around us. More importantly, who want to grow well, who want to grow old with dignity and with the expectation of the lives and the standards of living that they have already enjoyed as individual, dignified people. So there's so much happening. There's so much happening in research. There's so much happening both domestically and at a European level, and it intersects and it sits together very, very well. I so badly wanted to come today for the following reason. One, to be really, really clear about the Irish Government's commitment to research, to the Health Research Board, and to thank you, more than anything else, to come to thank you for the work that you are doing as researchers, as experts, as scientists, as contributors to the policy-making environment based on data, based on science. I am delighted, as I already mentioned, Grania and Tracy, new chair, new CEO Grania, and new chair Tracy, for their commitment to the HRB. I had the pleasure of meeting them both recently, as I said, and I wish them well in their work, working with all of you. So thank you so much for having me, and I look forward to continuing to work with you all over the next number of years. Thank you.
Now, good conferences are not just about presentations. They're also about networking, developing new relationships and strengthening existing ones. So let's go down to the conference floor and hear what attendees are talking about.
When you're working in health and social care research, the research contexts that we're working in are so different And so it's a nice opportunity to be able to meet people who work in different contexts like hospitals, community services, and to have this forum to bring us all together with a shared agenda.
I am every day struck by the goodwill of patients towards research. But I do think that research is for many reasons, but it is underpinned by a belief that the research in which they're participating in, which they will more than likely not benefit from, will benefit others. And if we conduct research which is purely of academic interest, I think we will be taking that goodwill for granted and may well lose it. So I hope to take away from today how to ensure that that goodwill continues.
So I suppose what I was hoping to get out of today is to hear what's happening in Ireland in terms of the work that's been done to inform evidence or to inform policy. So I was particularly drawn to the talk from John Lavis to see internationally what's happening in terms of getting evidence into policy. So that was a really great talk. And then I was interested then in hearing then from the different speakers in terms of the case studies in Ireland of what has worked and what has worked and what has not worked so well in terms of getting evidence into policy. And then my colleague, Dr. Barbara Whelan, then was presenting the rest of findings in terms of that assessment of evidence supports in Ireland and the plan for going forward.
The reason why we came here today, because obviously the Health Research Board is such a key player in the Irish health research ecosystem. And indeed, so are research nurses and midwives. We learned recently from the National Clinical Trials Oversight Group report that research nurses and midwives make up 40% of the clinical research delivery team. So important that we're here to understand what's happening at a national level and indeed for evidence-based policy.
One of the HRB's key roles is providing data about substance use in Ireland. Brian Galvin is HRB Programme Manager for Drug and Alcohol Research, and he gave a presentation on a recent HRB knowledge brokering event about developing policies to address substance use. Brian came in to speak with us in studio.
We had a couple of goals for doing this event. We wanted to draw on the other policy areas who should have an input into drugs, but it's funny, it's narrow. So we wanted to give people a broad span of policy, an overview of drugs. Particularly interested now because we're at a very unusual stage in drugs. We were just coming out of a period of opioid use, heavy opioid use, and it's the whole drugs world is changing. So there's a need to look at it in a very different way to respond quickly, not just look at trends, but to be a bit more agile. And we had a feeling that there was a need for not just our colleagues in health, but throughout all of government to get an understanding of that, that we need to be to look at all the different signals available and so on.
So Brian, you refer to a need for infrastructure to build trust in policy development. What might that actually look like, and does knowledge brokerage have a role in that?
It is a part of knowledge brokerage, and I suppose I said in the talk, and it was because it's a fairly short talk, I didn't go into it in that much detail. There's not a theoretical basis for this type of word, knowledge brokering. There's a lot of valuable work going on, and there will emerge, a theory around knowledge brokering that people can use. But there's a lot of the work is case studies, it's piecemeal and so on. But one area that seems to have a lot more promise is to develop an engagement between people in policy and research, not just about getting evidence to the policymakers on the desk and so on, but create an environment in which people can discuss and thrash things out. I think John's talk earlier in the day was he a very interesting phrase, a good client. I think what he meant by that is somebody, a policymaker who's interested, who's curious, and will make time to hear evidence. So we believe those people are there. So what we want to do is ensure that there's a forum, a stage, or whatever you want to call it, where board research and policy can meet and talk. One thing we had discussed prior to this event, because it took a lot of effort to put together, what do we want to get out of it? And one thing that we thought would be a concrete outcome would be a research network. And that came up during the event, and I think there was a strong consensus that something concrete, something real like that could make a difference and create that that infrastructure of trust and dialogue.
Okay. And you said earlier on that the available data could be used better. That's obviously an issue across the health system. What had you in mind?
Yeah, I suppose we're looking at drugs in one way, and it's nice working in this area because we work as part of a network of countries in Europe, and we gather our data according to particular standards, and we're required to do that through EU legislation. So we have really excellent data on treatment, and we can compare our treatment data with Estonia's and Slovenia and France, because everybody collects data in the same way. So a researcher in Trinity once was amazed, who came back to Ireland and said, we don't know how many people have hip replacements here in Ireland, but we know how many people are in drug treatment. So it's really excellent data, but we have information systems in the HRB that gather that data. We do services and so on, but the data itself is not analysed to the extent that it could. We don't have the capacity to do as much. We do some, but we need people in universities to take this on to make drugs part of their interest. We need a PI who'll say, "Look, I'm interested in this. There is great data there. We need to spend time."
So there is good quality data. It's just how it's utilised.
It's not analysed enough.
Sure,
that's the point. Yeah.
So you mentioned that the sessions drew the conclusion that early intervention and prevention approaches as part of a long-term strategy are what's needed, and you specifically refer to a review of prevention services. It's not as straightforward as it sounds. Actually, can you give us the background?
Yeah, it's the UNODC. It's the United Nations office that is concerned with drugs and crime. They've developed a mechanism to assess prevention services in countries. So what they want to do is see, are people using their standards, because there are prevention standards. Prevention is a science. It should be done in a particular way. And we saw that Norway had done this and done a very nice job. So we wanted to be the first EU country to do it. And I'm not saying it came out of the Knowledge Bridging event, but the importance of making prevention a core part of drug strategy did come out very strongly. So we were in a good position then to go to the Department and say, look, this is a tool that we can use to decide where we stand in drug prevention. Because just like I said, research is diffuse and all over the place, fragmented. So is prevention practice. So we needed to get a better handle on that. So it's called the Review of Prevention Services, and we're working with the UNODC on that, and we're going to publish that early in 2026. It's almost ready.
And that was Brian Galvin, Programme Manager for Drug and Alcohol Research at the HRB. Now let's go back to the conference floor. And here we tune into the panel discussion about the theme of the conference, Advancing Evidence-Informed Policy for Health and Social Care in Ireland. Dr. Claire O'Connell is the moderator.
The questions are already flooding in, so that's wonderful. There's one specifically there for you, John. Do we know what good evidence looks like done quickly? Is there a consensus on what this looks like?
There are no, I don't think, agreed norms here. I think there are a lot of people doing this. How do we get you the best evidence in whatever time you give us? And we're all trying to do our best and saying, okay, we'll deliver this. If you give us another 5 days, we'll add more bells and whistles. But what the right bells and whistles are for those different time periods isn't agreed by these diverse folks. So I think right now through the Evidence Synthesis Infrastructure Collaborative, we have these opportunities to bring together these evidence intermediaries from around the globe, look at our different practices, and over time ask the question, should we have more harmonization, but also where might we need variance because of local political context, other things.
Exactly. Great, thank you. We might go back to, we saw during the pandemic that the public was discomforted sometimes by rapid decisions and rapid changes. Might public trust be adversely impacted by rapidity?
I think, the pandemic, I suppose, is a good example. in the beginning of any pandemic or health threat, I'll talk about infection because I'm an infectious disease doctor, there's a lot of uncertainty. And I think it's okay to be, this is about communication with the public and understanding behaviour and behavioural response. I was really glad to see in some of the talks about the importance of behavioural science in it. I think once you communicate as much as you can with the population as to how decisions, the process by which decisions are made, that you base it on the science at that particular point in time, so that when people retrospectively correct everything that they felt we should have done at the time, that there's always a caveat. This is the moment in time, this is the science we have, and these are the reasons we made the decision. But to me, it's about absolute communication I'm speaking from a department point of view, up to the minister and into cabinet, but down to the operational arm of our health service, the HSE, but really, really importantly to the population. I think we're fortunate in Ireland. We have a really educated population that get it, and I think if you communicate, you can bring them along in the journey. But rapidity sometimes does need to happen, and I think we could be more rapid in a lot of the decisions we make, because science changes all the time, and if you're really 12 to 18 months doing evidence synthesis, by the time you get to the 18 months, whether it's the drug or something, the drug has got cheaper or whatever. So.
Did you want to come in?
Well, just to say that, and I think we learned this lesson during COVID. I hope we never have to relearn it. Context shift, issue shift, evidence shift, and we need to communicate that with humility to people. Things will evolve, and I think one of the evidence innovations that really came online during COVID was living evidence syntheses, where as the context shift, as the issue shift, as the evidence evolved, the evidence syntheses were being updated in real time, and that will soon become the new normal. That we'll be able to turn to these living evidence products and in a moment in time say, what is the Irish specific contextualized message that we can take away from this now? And we all have to know that when we come back in 6 months, it may look a little bit different. But we need to have the humility to recognize that. And to your point, Mary, we need to be able to communicate that to the public.
Absolutely, absolutely. And I assume that AI is a huge game changer in being able to do that. So maybe we can talk about that for a second. I mean, Jennifer, AI is something that it can be very helpful, but is it practical to use it when you're working in an environment where you're developing policy?
There is a danger there. I think we do need to, not just a danger around, and I mentioned AI hallucinations and it giving you weird results, but actually a danger in people understanding how to use it properly. In that, and I suppose go back to the earlier points about evidence synthesis and having, I suppose, a well-resourced evidence capability or unit within all government departments that understands how to use these tools, is trained appropriately and resourced appropriately to do it.
So again, it comes back to skills and resources and things like that. Yeah, absolutely. Let's see, there are lots of other questions. It seems clear that there's a need for an independent, well-resourced knowledge brokerage entity or organisation in Ireland. How do we get there? We heard about the success of the one that Brian talked about with the HRB and the IUA that worked so well as a case study. How do we kind of scale up on those kinds of successes? Any thoughts?
I might say that I think maybe when we say an entity, I don't know that we'd necessarily get to an entity or an organisation. I think what we might try to get to is consistency of approach. So if we had in every university, institute of technology, maybe state research organisation, maybe the health service, a similar kind of office or organisation, and have those offices working together in a network or a community of practice so that they can share learnings and so they all do things in a relatively similar way. Obviously, some institutions will have a slightly different bent than others. I think that would be good. And then similarly on the civil service side, to have some sort of consistency of approaches to where this, the responsibility for this is located. And then if we can create the bridges between those organisations, I think that would work really well. I don't know that we'd get to the point where we would set up a kind of a knowledge brokering Ireland kind of office, although perhaps maybe the Campus Engage office of the Irish Universities Association, if appropriately resourced, could maybe fill that gap in some way.
Teresa, did you want to say something?
I was going to say along the same lines. I think at this point, I don't think that I would jump instantly to thinking of an organisation or an entity. I do think there are people in this room that would walk around and I would see them as a knowledge broker. They probably don't see themselves as a knowledge broker. I think the more we talk about this and people kind of identify that some of the role is that we acknowledge that we acknowledge the importance of it. And I think at organisations at all levels, whether that be within funders, whether that be within evidence producers, definitely within the department, I think that is important. I think another point I would make is that I think knowledge brokerage happens at different levels. I mean, I suppose that's just something that has struck me. The more we're engaging as a funder, I think the HRB are pretty unique in some senses that, you know, the Venn diagram that you threw up earlier of the research support system and the evidence support system. I don't think we really had the language on it, but I think we have been supporting the evidence support system for many years. So we're kind of like a funder plus, but it has brought us also, as witnessed by the very good, I think, dialogue and relationship between our department and us as their agency. The more we've moved into that space and really start to put evidence for policy under the bonnet, I think there's department-wide knowledge brokering, you know, we've talked about the statement of research priorities or the areas of research interest. Like, there's a brokering that needs to happen around that. There's a methodology around that. There's an approach to do that and to do that well and to do that at a frequency that the minute you walk out the door with it under your arm, it's not already out of date. Yeah. That's really, really helpful for long-term guide and signalling to research communities, to early career researchers and to the research community on the supply side. And then there's the, I suppose, the more time-bound windows that we've really been talking about here today, where somebody has a problem or they need a solution, they need to understand something. Then there's brokering at the question setting, the where do we get it, and then when you have it, what is it telling us and what do we do with it piece. So the more, it's knowledge brokering as a term is something that for me, I actually tie myself up in knots about, because I think the context, the purpose, the use and the time window within this. So I think lots more to think about in that, but I think it's really, really great that we're talking about knowledge brokering. We're talking about the capabilities and the skills and the competencies of knowledge brokers. We're talking about knowledge brokers distributed in all sorts of organisations, not in any one. And I think then it's a job of work to try and put some sort of, there's definitely some sort of structure or coordination or something on that.
It goes back to that informal network. You're formalising the informal network so that everybody can access it, not just the person that you went to college with or you worked with back in 2008 or something. But what concrete change would you like to see in how policymakers commission and use evidence by this time next year? Any thoughts on that? Mary?
Okay, 1 year deadline. I think it's knowing who's out there and what they're doing. I mean, that should be a fairly, you know, it's mapping who's out there. I think we underutilise our international networks. There's no point in us doing, you know, our face maps, good or bad. I mean, we know other people are doing it. So I think we need to dip in and partner, collaborate. What we do, exchange, knowledge exchange with other partners internationally. We heard from some of them today, and particularly within the EU. So what can we get from them? What can we give to them? I think they're fairly straightforward things that we can do at an early stage. And obviously we all, you know, there's always kind of, well, if we fund some of those, but I think it's knowing what we have within the country, optimizing the skill sets, because some people do behavior, some people do HTAs, other people do rapid live synthesis, and then going outside the other system to see how we can really strengthen our global relationships with knowledge exchange. And I don't think that costs a lot.
No, that's more about attentional awareness, isn't it? And sort of, yeah, absolutely. Jennifer, any thoughts on that? I'll come to you next time.
Yeah, it's a very tough question. I think what I would love to see is for all the policymakers in my department to, I guess, to know who they should be talking to and have the channel to be able to talk to them. So having an understanding, so if they're assigned to work in a policy area like land use, that they understand who the key researchers in Ireland and internationally are in this area, and particularly in Ireland, that they have a way to be able to discuss and meet with these people when they need to. So.
Great. And would you see that as being creating the channels or creating fora where people are busy, they have lots to do all day, and if they have to use part of their brain and their bandwidth to kind of go, oh, well, I need to ring, Mary McGrath down in Kerry about this. That's whereas if there were regular fora where people got together, maybe they'd naturally be meeting.
I think
Mary
it's
McGrath
a little
and
bit
Kerry.
of both, to be honest, Claire. I think we probably do need fora. We need to, and part of my role in the department is to try to create those opportunities for people and organise events where they get to meet with people. But I think also we do want to get to the stage where they are able to approach and they feel comfortable.
And they're done with that
channel.
purpose as well of that knowledge brokering. Great, good stuff. John, did you have thoughts on the concrete thing?
Yeah, well, I guess it feels like a year is more than enough time to say every department should be able to say what their pit stop is. Where do you go when you have a policy question and you're trying to mix and match to the relevant forms of evidence? So what are the best sources of evidence out there for that type of evidence that you're looking for? Who are the best researchers in Ireland that you want to help involve in contextualizing the process? That seems to me to be low-hanging fruit. And to build on Mary's point, it's partly about mapping. And then you need people who can hear the policy question and say, oh, okay, well, do you realize that every synthesis in the world about how to strengthen health systems is all sitting in one place, all quality appraised. It's called health systems evidence. For goodness sakes, go and use it. Yeah. Did you realize that in Ireland you have these 3 leading health systems researchers who can help to contextualize that evidence, but also put the local Irish studies along the way? So just that mix and matching approach, I think that's a realistic expectation. Yeah. Know your pit stop by the next year, and if it doesn't exist, create it.
And let's stay with the conference floor, but this time we'll go back down to hear more from some of the attendees.
It was really insightful. I found really all of it was really good, and just the quality of speakers and the talks. And I think one of the things that struck me was the sort of informal structures that we have in place that are very people dependent, and how we're kind of moving more to sort of a systemic and a structured system for how to inform policies through research. So that was a really interesting aspect of it.
How research questions get presented to the researchers, the mechanism that comes through. Like we're saying that we want a more structured mechanism for that, but we're also conscious that those individual relationships between people, we can't lose that either, because they're very valuable. So how do you kind of, what would you say, have a mix of the two? That question is probably what I thought of most today.
I think for me it was just really useful to get a sense of internationally what's going on, because I used to work in the evidence centre in HRB. So attending the conference today was nice to get an update of what's happening in the evidence synthesis space.
Yeah, well, what attracted me to come to the conference today is I'm actually new to the health sphere. I only joined the department in June, and I'm doing a piece of work that's very heavily dependent actually on evidence to inform the policy making that we're going to be doing. So I thought that this would be it was a really useful session for me.
I think probably the highlight for me was Dr. Anastasia when she's talking about the Joint Research Centre in the EU, because I think they have a really big scope and they cover a lot of the things that I am looking at as well.
2 things I took from it was the need for rapidity or speed of rapid evidence synthesis, and the need for policy to be fundamentally driven by this, and also the need to use new innovations like AI.
Everyone was so good. So it's bits and pieces from every discussion, every individual speaker that ultimately just gave so much. And like a jigsaw puzzle, it's all bits and pieces of information that have sort of given me what I'm going to take back home today.
And next, let's zone in on a topic that's dear to everyone's heart in the research community, the thorny question of how to connect evidence to policy to achieve better outcomes. Dr. Anastasia Delichiari, policy analyst at the European Commission's Joint Research Centre, and Stefan Jacobson, senior advisor for public management and budgeting at the OECD, gave a presentation to conference about enablers and constraints involved in successfully connecting research to policy. They both came into the studio to talk to us. Your presentations, they really got right to the heart of our conference theme, advancing evidence-informed policy, and obviously in our context, that relates to health and social care. Stefan, you've advised governments all over the world and you conducted a review of the Irish Government Economic Evaluation Service. As you mentioned in your presentation, health is a major area of public expenditure. Certainly in Ireland, we've seen the budget double in the last decade. Can you explain briefly how the economic evaluation helps evidence-informed policymaking?
Thank you very much for the relevant question. Economic evaluation is key to having evidence-informed policymaking in healthcare. Since there is a lot of money to be spent, you need to make sure that you spend this money wisely. And how can you do that? You need to do cost-benefit or cost-effectiveness analysis. You need to look at the cost of the treatment and what the gains and the outcomes are for patients. And treatments that are expensive but deliver improved outcomes, then you will have a positive recommendation. But treatments that are super expensive or do damage patients, of course, you should not push for them. But I would also say that economics is not the only discipline. You need multidisciplinary approaches for evidence-informed policymaking in the health area, particularly with public health, with epidemiology and also psychology, cognitive behavior. So you need multidisciplinary approaches so that you have the relevant expertise to address the complex challenges that you have to assess.
Okay, because you referred to that cost-effectiveness dilemma in your presentation, and we know this is really problematic because on one hand we want more accessible health systems, but we also know that health budgets as a proportion of public expenditure, they're likely to keep rising due to that ticking time bomb of our ageing demographics, and certainly in the West at least. So when we consider that the renewed OECD performance assessment framework sees efficiency as a core component of evaluation, how can we balance that expenditure aspect of efficiency and make it work alongside the principle of equity?
In fact, there are several dimensions of efficiency. Efficiency can be seen from the sort of the technical efficiency perspective. How much operations can you do and how can you be super productive at delivering so many operations? And you can apply that to elective surgery such as cataracts or appendicitis. But spending a lot of money to treat all patients for appendicitis, even those who do not need it, may also be seen as a waste of money, which is why you have to focus on allocative efficiency. That is, how much do you gain in terms of actual health outcomes and health improvements for patients. But even from that perspective, this is not necessarily so easy because you have to reconcile various principles of equity. And OECD countries, there is not a uniform understanding of the notion of equity. And you have equity in terms of access to care and also equity in terms of access to healthcare according to needs. But the reality is often that patients receive healthcare where they live, and richer or wealthier patients have access to more doctors because there are usually more doctors or hospitals in cities. And so this is a complex issue, and every country has to find the solutions that suit their political framing and understanding. But this is surely one concentrate of that all health policy makers have to grapple with in all OECD countries.
Thank you. It really paints a picture of how multidimensional this is. Can we move on to the question of the professional competences to have truly effective evidence-informed decision-making? And probably a good place to start is the EU policy cycle, which, Anastasia, you summarised to the conference. Can you outline briefly what that is?
Yes. What I've mentioned in my presentation is how the Joint Research Centre supports policy making throughout the policy cycle. So we know that the policy cycle starts with the initial ideas, agenda setting, and ends up through various stages to the implementation and evaluation. So evidence, and the scientific evidence particularly, comes in all stages of the policy cycle. So the JRC works in three ways in supporting this policy process, which we consider our strength in providing evidence. The first one is like having an anticipatory mindset. So that's more like looking ahead, trying to understand what are the future challenges and what are the key challenges that we can already start to address, according, of course, to the relevant knowledge we have. That's a kind of proactive way in working in policymaking and informing the agenda of policymaking from the beginning. So that's the first, pillar of anticipation. The second one is integration. So we are trying, as we say, to connect the dots. We're trying to break the silos and bring together disciplines because we work in an interdisciplinary way. So we bring scientists from different disciplines to understand the problem in all of its aspects and enable the collaboration between these different perspectives. because we need to understand all the different perspectives of a problem. That allows us to integrate science, not only that is science that's produced in the GRC, but also externally, because of course science does not have any borders. It needs to further collaboration to understand all the perspectives. And the third one is about impact that comes actually at the end of the policy cycle. Is JRC is the scientific and knowledge service of the Commission. We're not policymakers. We are trying to provide the quality assurance tools, evaluative frameworks in order to assess the impact of policies on societies, on people, and in that way we can inform let's say in a more concise perspective the new cycle. The monitoring the policies helps design the new cycle because you really understand the strengths or perhaps weaknesses, shortcomings and challenges, and you can have a new policy cycle because it's always a continuum that is better informed on what has already happened.
And I know that one of the things you touched on was the need to break down silos. Can you talk to me a little more about that?
Yes, because today we face problems that are very complex and require more than one discipline, actually, to come together to understand this complexity and disentangle the different aspects of a problem. That speaks to kind of breaking the scientific silos, because also scientists work in their own discipline, which is fine because they actually bring in-depth expertise, but they also need to work in a horizontal way, to collaborate, to ensure that they have really engaged with other perspectives and other disciplines. That's for the scientific level of work, but it's also important to ensure that policy DGs in the European Commission, but also ministries in countries, are also having this collaborative approach, because when we speak about the policy area nowadays, I'm not sure there's any single policy area that can really be addressed only with one policy perspective. You need really to ensure that you understand all the different layers. So bringing this approach of collaboration, integration, and synthesis is important if you want to have effective policies that really speak to all the dimensions of the problem to the best possible extent, of course.
So finally, a quick question to both of you. Anastasia's presentation referred to a wide range of other competencies required at the policymaker side and the researcher side, and it's very extensive. So how close is any country or the EU itself to having the full range of competencies required? Stefan, I might come to you on that.
Yes, just these competencies frameworks are more aspirational tools. They are not subject to actual measurement for the moment, but I think the ambition was to make sure that countries could use these competencies frameworks in their civil service so that they could actually measure and promote competency improvements across those lines for the staff in the various civil services. And this was part of the recommendations that we gave, for example, in the countries with which we engage as part of the multi-country project on evidence-informed policymaking in cooperation with the Joint Research Center. This was also part of the materials that, together with Anastasia, we developed for the workshop, for example, to help policymakers understand how to ask the right questions, how to take a critical eye at evidence, or for researchers, how to make sure that they know how to communicate the findings, how to use clear language and be able to go in an outward way to the outside world.
Anastasia?
Yes, just to clarify for the competence frameworks, they are models, right? They are learning and development and capacity building tools. That means that they try to map, synthesize, and structure the relevant knowledge we have on the competencies and skills for both scientists and policymakers to work on science for policy interface. That, of course, does not mean that an individual can or should have all these different competencies. But it's important to know them because they work at an individual level, but also on an organizational level. Mm-hmm. So it might be that one individual cannot really have all the competencies. And as we know, every single person has its own skills and competencies. But at the kind of team level or organizational level, there are very good tools in order to understand the strengths and the weaknesses in a team and to build either trainings or capacity building actions in general to strengthen the skills and to ensure that the team can really work together in a way that can really deliver. Because being a knowledge broker and work on science for policy, it's always a teamwork, even if it relies heavily sometimes on individuals to drive the process.
And that's all from our special health research podcast from the HRB National Conference in Dublin. You can listen to all episodes on major podcast platforms. and on video on the Health Research Board YouTube channel. Links to audio and video versions are also available on our website at hrb.ie. Thanks for tuning in, and we'll leave you with some of the sights and sounds of the HRB National Conference 2025.
And really today is about building that momentum and where we go to next. That this is the trusted voice, this is the way to do it, and how can we collectively come together to make this happen?
Really is the first time that we're looking, publicly presenting in detail a rapid evidence support system assessment in relation to health policy making in Ireland.
I was thinking about how much Ireland has evolved from a research perspective, from a health perspective since 1986, when I suppose you're celebrating your birthday.
We have some questions there. The top one there. The concept of uncertainty absorption is fascinating and chilling. How can we guard against this on both sides of the conversation?
Trust in science is trust in governments. It's also trust on how governments use science.
To echo the Minister's appreciation and support for the Health Research Board and for the health research community.
Today really has been a fascinating overview of some of the developments in Ireland and internationally.
This podcast is a production of the Health Research Board, Ireland's state agency for conducting and funding health and social care research.